You can identify blood sugar signs from a distance, which will help you identify the problem fast and correct it. The onset of diabetes usually occurs when there is a disruption in the insulin balance that has been established in the body. The excess insulin is stored as fat, and this will have a devastating effect on your health. If you're new here, please do subscribe for more interesting videos. The first type of diabetes is called non-insulin dependent diabetes. In this condition, the body does not produce any insulin at all. Hyperglycemia usually follows after the lack of insulin, which is the most common diabetes. This diabetes can only be identified with a blood test. Insulin-dependent diabetes is a chronic condition where the body has a tendency to produce its own insulin, which is necessary for controlling blood sugar levels. This is a more serious type of diabetes and can affect your life and that of your loved ones severely. There are lots of complications associated with this condition. Even small incidents of elevated blood sugar levels can result in heart failure or kidney failure. Each of these blood sugar signs are indicators that the body is not processing glucose properly. A diagnosis can be made with a blood test. The symptoms for each of these conditions are the same. When you have low blood sugar levels, you will experience restless sleep, hunger, irritability, fatigue, dizziness, dry mouth, blurred vision, low levels of energy, constant thirst, and other symptoms. The signs for all of these conditions are the same. When you have high blood sugar levels, you will experience a number of symptoms as well. This includes frequent urination, headache, confusion, palpitations, leg cramps, tremors, sweating, extreme thirst, and a dry mouth. The signs for all of these conditions are the same. A diabetes test should be performed periodically to monitor your levels of blood sugar. Any abnormality that is experienced during a routine test will alert the doctor to your need for immediate medical attention. It is important to remember that the results of this test may be incorrect in some cases. Diabetic ketoacidosis is another complication associated with high blood sugar levels. A patient's body will often break down carbohydrates into acid, causing them to excrete a great deal of carbon dioxide through their urine. Sometimes, the patient may also suffer from seizures, coma, or respiratory arrest. In some cases, the patient's skin will turn purple due to frequent urine production. One should always be aware of their diabetes symptoms so that they can identify the need for emergency medical assistance. Monitor your glucose level every day, since this will help you know when the symptoms are present. Usually, you can tell if you have a serious complication by looking at your results on your blood test. This will enable you to make an educated decision about treatment and other options available to you. Chronic uncontrolled diabetes is the next complication that is associated with high blood sugar levels. In this condition, the body loses control over its insulin production and causes the levels of glucose to rise dangerously. This condition can easily be fatal. However, in order to ensure that you stay well and healthy, monitoring your blood sugar levels is essential. It is important to understand your conditions to recognize the signs and to act appropriately before the situation becomes worse.